The Wellness Hour. An in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
You are watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, a 20-day program for injured workers that are in pain. And there are two types of patients that we're going to talk about today. Those that are going back to work and those that have to live with their pain that are not going back to work. And with us, we have the administrator and founder of Chronic Pain Institute. It's in Houston, Texas. And with us, we have Jerry Schultz. Jerry, welcome to the program.
Thank you, Randy.
Before we get into today's topic, tell me a little bit about your center, the Chronic Pain Institute.
Well, Randy, the Chronic Pain Institute is in Houston, Texas, as you mentioned, and it is an institute that I founded. And what I have done is conceptually brought all the doctors and all the specialists, including psychologists, into a center that we can treat virtually anybody that is in pain and needs help.
On the phone, you told me, you said, we're serious about pain, Randy.
Pain is our business, and even within pain, we have a specialty. For instance, we don't work with stomach pain or if your throat hurts or something of that nature. We deal with injured workers predominantly. We also deal with Medicare patients or managed care patients who are in what is known as chronic pain, may have had one or more failed procedures, and a failed procedure is a surgical procedure that you've had to eliminate pain, but after the procedure, you're still hurting. And that's where we pick up the program.
So a bulk of your patients then is the injured worker?
Yes, we do deal a lot with injured workers. Their pain seems to be chronic, and we continually will address that pain as well as the psychological issues of the pain, which is probably one of the most overlooked aspects of the healing process.
Okay, good. You know our program airs throughout the U.S. and Canada, and I have access and talk to a lot of medical doctors. A very unique setup you have at your center. So what is your role as the administrator at the center?
My role is to make sure that I have brought together the most professional physicians, the most updated equipment, and that we have a patient care bedside manner that is customer friendly, which you don't hear much in the medical business. But my job is
tell me about that. Tell me about that.
Well, my job is to blend the medical aspect with the business aspect, and that's why
like any hospital administrator must do. Is that right?
It's a constant challenge, but yes, sir, that's what we do.
Okay, so moving on to today's topic, the injured worker. Now it's new to me, and maybe you say a lot of people don't know about it, but you have a 20-day pain program. You call it a pain camp that is covered by insurance. Tell me a little bit about it. And who's a candidate?
We coined the phrase pain camp. What workers' comp in Texas knows it as is the multidisciplinary pain management program.
Okay.
It does get confusing because pain management can also mean medication management. It can mean an invasive type of procedure. Those are all things done to address pain.
So you do injections and things like that at the center? Okay.
And the third dimension of pain management, Randy, that most people are not aware of is the 20-day multidisciplinary pain management program. And this is a workers' comp program that workers' comp will approve and will allow workers that qualify for this to enter into this program.
And most people qualify, you say. I mean, if you're an injured worker, even if you've been on 3 or 4 years, you can get and be part of this 20-day program.
That is correct, with a small caveat in that there are two directions to go. If a worker is injured and has been off the job for a while, but is healed or healing, okay? In a lot of cases, you may have atrophied because you've been dormant for, say, 3 or 4 or 6 months. What we do is we put you in a work hardening, which is also called a return to work program. And that's for the injured worker who we will bring in, do a test on them to see where they are physically, and then we will work them through 20 days in our physical therapy unit, which is also on site.
This is a comprehensive program. I mean, you feed them. You can even provide, I guess in certain cases, insurance covers transportation, lodging in certain cases.
Yes. The Texas workers' comp system, it really is a very good program, and they just really go the extra mile for the injured worker, and they do allow us to provide transportation, meals, and in some cases lodging for these injured workers if there's not a program in the close vicinity, or if some type of economical hardship will prevent this injured worker from attending our program, then we provide those services for them.
And the second category is what? Okay, so the people want to go back to work, and the other category is what?
The second category, and we see a lot of this, and that is the worker who has injured on the job and has had multiple surgeries and is still hurting. And that's unfortunate, but it is
So they have to live with their pain.
They have to live with their pain. And that is why we call our program a multidisciplinary program, because it is psychologically based. Now, we do have the MD on board and on site. We have physical therapists on site. We also have licensed counselors on site to help you live with pain.
And that's covered by insurance.
It is covered by the workers' comp insurance.
Okay, now I'm going to put you on the spot a little bit here on the phone, because we heard about this 20-day program. It was covered by insurance. And by the way, if you're just tuning in, we're talking about what every injured worker needs to know. We're here with the administrator of Chronic Pain Institute, and we're talking about this 20-day program. You told me on the phone, and I'm going to quote you. You said, Randy, they would be lined up around the block if they knew about this program. Okay, that's your feeling.
And I've been in this business, Randy, for 15 years.
Okay,
and the program is not widely known by general practitioners.
Interesting.
By even some of the orthopedic surgeons. They just don't know what to do with the chronic pain patient. And I'm sure you've seen the evolution in the medical industry of pain doctors. And that's what we have now. It's some place for the general practitioner, the orthopedic surgeon, to send these chronic pain
to manage
patients.
Addiction and things like that.
Yes, sir. But again, a lot of the medical community is just not aware that a 20-day comprehensive program exists that helps these workers deal with the psychological issues of healing.
Do they need to know, or do they need a referral from their primary care physician to see a center like yours? Can they call you directly? Is my question, I guess.
The answer is yes to both. You have to have a script to get into the program. Now, the script can be written by a company doctor. The script can be written by a chiropractor. The script can be written by your family physician. We also have physicians on staff that you can come and see. We will do a full comprehensive evaluation, and we can also handle that script. I do want to point out here that in Texas there is a form inside the workers' comp system called a 53 form, and that is where an injured worker asks to change doctors. And I just want to really emphasize here that we do not fill out these 53 forms to treat these workers. We don't want to take the patient from the treating doctor unless the treating doctor wants us to do that.
Okay, good. So this program is available for the injured worker, and most of these patients, by the way, is this true? They could choose their own doctor? The worker, the person that's on workers' comp can choose their own doctor, or do they have to go to the company doctor?
Well,
in Texas, what are the rules?
In Texas, without getting into what type of a contractual relationship you might have with your employer, ultimately, in Texas, the injured worker has the right to see their own choice of physicians. Now, I know some company policies say you see the company doctor first, and so, but ultimately, the injured worker can choose his own physician.
Now, what are the benefits? And we're going to take a break. I mean, what are the benefits? Injured worker watching this, obviously they know who they are. What are the benefits to get involved in this 20-day program?
The benefits are just incredible. I mean, first of all, we deal with your pain. We are not afraid to address the medication management issues. We do a comprehensive physical to make sure that any procedure that may have helped or will help has been done. If not, we do a lot of these procedures in office.
And you said you work them out in the gym and everything. I mean, they sometimes can spend the whole day there.
Yes, sir. The program is a full day. Now, we typically will work them into that. You know, it's a challenge.
Depending on their situation, lifestyle, whatever.
Yes.
Okay.
We work them out in the gym. We have our own physical therapy unit on site, and so they spend time one-on-one with our psychologists, and then they spend group time. And that's another tremendous benefit is when you're in a what we call a group session, and you're in there with 5 or 6 other injured workers who are not able to work and have the same struggling issues that you have. It's a bonding issue, and you realize that there are ways to cope with this.
So they meet every day with the psychologist?
Every day.
Is that right? And how do they respond to that, by the way?
Are
they okay with that?
It's phenomenal. I mean, they do things that, I have learned so much in the last 10 years watching these people, both from the worker side as well as from the professional psychologist side. It's phenomenal to watch.
We're going to take a quick break. More about the process, what happens on day one. Kind of take me through what the injured worker can expect. You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. What every injured worker needs to know. We'll be right back. You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. What every injured worker needs to know. It's a 20-day pain camp. Insurance covers it for most patients. With us, we have the administrator at the Chronic Pain Institute. Okay, Jerry Schultz. Now, again, your role at the center, you oversee the medical doctors, the psychologist.
And the physical therapist.
Okay, and you manage that patient experience.
Yes.
Because the pain patient, I guess, could be a little bit grumpy, right?
Well, we can all be a little grumpy.
All right.
But we let them know that we care.
Now, so going into this program, if somebody's been on workers' comp, okay, and let's say 3 years, are they still candidates?
They are indeed candidates. The workers' comp will allow...
if they haven't done it before, is that
Correct.
right? Could you be on 7 years? If you're...
We have had people in the program whose date of injury was 10 years old.
All right.
And those are typically, obviously, pain management patients. But yes, the date of injury, if you're still in pain, then it is still workers' comp goal to get you out of pain, and that's where we come in.
Okay. Now, what about so physical therapy is covered? What if they've already used physical therapy? They say, they're watching this and they're saying, I've already been through physical therapy though. Are they still candidates? Will insurance still cover it?
There are limits to the benefits.
Okay.
But if we identify an injured worker as a candidate for a pain management program or a work hardening program, then once the workers' comp system approves that, they are acknowledging that it is about 50% physical therapy and about 50% psychologically based. So we do work with the physical aspects of the pain patient. We also work with the mental aspects of the pain patient.
Now, what's your hunch? Okay, so there's thousands in Houston that are injured workers, not working, can't go back to work or whatever, that don't know about this program. Would you say there's thousands, more than thousands?
I would say easily there are thousands.
Like 5,000, 10,000 people that would be candidates for this program and they just don't know about it?
Yes, sir. I think that the injured worker.
Interesting.
There are a tremendous amount of these injured workers that are going to see their general practitioner, and that general practitioner just doesn't know what to do with them once they're identified as chronic pain.
So for people just tuning in, though, it's this 20-day program is about getting people back to work, getting out of pain, or dealing with their pain. Is that right? Am I getting this?
That is correct, Randy. Okay. Our number one goal is to get the patient out of pain. And so although we are speaking predominantly today about injured workers, we also see a lot of Medicare patients and a lot of managed care patients who have chronic pain. Now, they are not candidates for the 20-day program, but for the injured worker, what we want to do with everybody that walks in our door is get them out of pain. Secondarily, we want to send them back to work. But that's second to getting them out of pain, whatever it takes.
Okay, now chiropractors will also watch this show. A lot of people going to chiropractors, becoming more and more mainstream. Do they send you patients?
We get a lot of referrals from chiropractors, and we ask any referral source to remain involved with the patient and the process throughout the entire program.
So you don't do chiropractic there. So you'll keep them with their chiropractor.
They stay with their chiropractor. We do not do chiropractic in our clinic. We do physical therapy. We do the psychological aspects of healing. And then we have an MD anesthesiologist who also does in-office procedures, which again might be a block or a cortisone shot. There are a lot of in-office procedures that most people think you have to go to a hospital to have done, and that's not the case. We do it under local anesthesia. We do pre-op, we do the OR, and we do your post-op, and it's all done right there.
But the pain patient that already has a pain management physician, but has not been told or informed about this 20-day program, and the pain management doctor is just not set up for this 20-day program. What about, can that patient call you directly? What's your advice to them?
The patient can call us directly, but so can the doctor. Because the difference is that third program that we offer to do the 20-day multidisciplinary program.
Yeah.
A facility has to have a full-time physical therapist on staff.
Okay.
They have to have a licensed psychological counselor on staff, and most pain doctors just don't do that.
So they could ask their pain doctor
Absolutely.
about this center.
Absolutely they can.
Okay, so on day one, take me through the process. Okay, so, and by the way, I'm sure partners and spouses are watching this, and they have this injured worker that wants to go back to work or has to live with their pain and cannot go back to work. How much of a paperwork hassle is it, the burden on them? On the phone saying, hey, I heard about this 20-day program. How do I get involved? Tell me about that. How do they cut through that?
Well,
you smile when I ask you that.
Well,
Why?
To use your words, the paperwork hassle is ours, not theirs.
Okay.
They make the initial call to us, and then we have to get their records. There are records somewhere. And then we start to see what they are candidates for. And in most cases, if they have not been to this 20-day program somewhere, then they are candidates. Because
that's a very simple thing. They could diagnose themselves at home right now.
Well,
maybe I'm oversimplifying it, but if they're on workers' comp and they've never been part of this 20-day program, chances are they're candidates?
Yes, sir.
Really?
For either the return to work program, or even if they know they're not going to return to work, then they come into the pain management program. So yes, they are candidates. And we handle all the paperwork. We get the forms. We have to hear from them. We talk to their treating doc, and then we start the ball rolling.
What about somebody that, this whole thing is a mess? They're working with an attorney. They're not getting answers. Can you work with, I don't know what it's called, a written letter from the attorney to get things started?
Yes.
So they don't have to wait?
Yes.
What is that called?
It's in Texas, and again, I reference Texas. We do most of our work in Texas and Louisiana. It's called a letter of protection, and we do get a lot of referrals from attorneys.
Letter of protection?
Letter of protection. That simply says we have a patient or we have an individual who was injured, and there is a dispute about who's responsible for the payment of services to heal this person. The attorney gets involved. We go ahead with treatment, and then the letter of protection that is given to us by the attorney guarantees that when the case is settled, whether that's 1 year or 5 years, then we're paid.
Do attorneys all know about this?
In my opinion, most PI attorneys do know that programs exist. I don't know if they all know about our program.
Okay, now of course, our studio's here in California, and my pain management physician friend of mine, Dr. Reinhardt, he's saying he's not aware of it. And this guy has a 50-employee center in Palm Springs, California. He says, I'm not familiar with it out there. So there's many other facilities, probably pain centers, that just aren't aware of it, or no?
The workers' comp system varies from state to state.
All right.
And we have looked, about 5 years ago, we did look at the California workers' comp system, and we just love Texas. We've decided to stay in Texas.
Stay in Texas. Okay.
And I've been in the business for 15 years, and we've been blessed in all 15. I have a tremendous staff, great physical therapists, great counselors, great MDs and surgeons, and I've just really been blessed, and there is just an incredible amount of injured workers that don't even know this program exists.
A lot of people suffering that don't have to be?
That don't have to be.
Now, the somebody watching this, turnaround time. Okay, so they're calling and they're saying, I want to know if I qualify. You say that the burden of paperwork and waiting on hold is up to you. How soon, as an average, can you tell them, yeah, we can get you on this program?
Well, that's a very good question. It's very broad. If it's a Medicare or managed care patient who is having a problem, we can literally treat that person with an injection or Medicaid or whatever the situation calls for. We can diagnose that and treat it in 1 or 2 days, depending on our appointment schedule, which takes a week or two maybe to get in. The workers' comp program, once we hear that from an injured worker to get them into the 20-day program, that can take 1 to 3 weeks, depending on how cooperative the treating doctor is, how accessible the adjuster case manager is. That is complicated, but one call starts the ball rolling.
Okay, very interesting stuff. Now, for people just tuning in, again, we're talking about what every injured worker needs to know. We're here with the administrator of Chronic Pain Institute. You're in Houston. A multidisciplinary approach to getting people back to work or to deal with their pain for people that are going to be permanently, I guess, disabled. So, I referenced the doctor here in California, and we've become friends over the years. I've had him on the show a bunch of times, and he says, Randy, I always ask him, if there's a mistake, the biggest mistake in the world of pain management, what is it? He says, these people are under-medicated, under-treated for pain. You nod yes.
Yes, absolutely. We see it.
Elaborate on that.
We see it every day.
I know his answer, so.
Well, Randy, the patient starts with a company doctor or a general practitioner, and these people sometimes need more medication than some of these professionals have the time to give them.
Plus, they're worried about addiction. Isn't that true?
Addiction is an issue, and that's one of the mental aspects of healing, and we deal with that with the psychologists. I mean, the addiction issue is something that we deal with. In fact, the multidisciplinary indicates that we are dealing with the mental aspects of pain. Some of these people do have to live with pain. We simply are trying to teach them the psychological issues and how to do it without as much medication. But we do not, I repeat, we do not back up from the medication management for these patients. We understand that is a key role in healing.
Okay, when you say we don't back up, what does that mean? Meaning your goal is not to take them off their medication?
No, sir. No, sir. We understand that a lot of injured workers and people in pain are under-medicated.
Okay.
And we do deal with that aggressively.
Now, so I understand, the politics of this and things like that the primary care physician, and correct me if I'm wrong, they're just not set up to full-time manage the pain patient, the chronic pain patient. Would they agree with this, a primary care physician, for the most part?
I think so, Randy. I think that
because they send them out, right? I mean,
they have to. In most cases, they're not. I mean, you can get a GP can order any test.
I've even heard they're brushed under the carpet, and I'm sorry for interrupting. Or like the pains in your head, or maybe they're even.
I honestly believe that almost all physicians are there to do good.
No, I agree.
I do believe
I didn't mean that in the wrong way.
No, I think that it's just a volume issue. I mean, if
they don't have the time.
They don't have the time.
Why do you have the luxury of time then?
It's a specialty. That's all we do.
Okay.
Our entire facility is full of people in pain. So we have the physical therapists on staff. We have multiple psychologists on staff. We have the surgeons and the MDs on staff. That's what we do.
Have you ever had on this 20-day back to work program where they went in pretty bad shape, and after 20 days they're wanting or able to go back to work?
The return to work program, absolutely. We do have stats that show that we have a percentage of the workers that do go back to work. And in our program, we deal with nutrition. We deal with vocational. Some of these guys that want to go back, men and women, who are off work, we also have vocational training. So if their job's not available, we might teach them how to do computer work or something that they can do with their injury.
And now a lot of people, I've done very limited research, by the way, on this topic, anticipating your visit. But for the people that are going to be permanently on disability or workers' comp or whatever it's called, they also get a lot of documentation after this 20 days. This can help build a case that, hey, these people just can't go back to work.
Yes.
Is that right? I mean, do you do that kind of paperwork?
Yes, we have to. And in fact, in Texas, years ago, we would get a pre-cert authorization number to treat this injured worker for 20 days. Now we get a 10-day pre-cert, and then at the end of 10, we have to show a certain level of improvement to get even the second 10. So we're doing what's called an FCE, which is a functional capacity evaluation, that tells us where this injured worker was when he entered our program and where he was at the end of the program.
How do you determine that? Like an airline worker or something? I mean, how do you determine that?
Well, it's interesting you bring that up because we do see a lot of that industry.
Interesting. Okay.
Well, they're baggage handlers that are on their knees. They're lifting baggage. I mean, it's some of them are prone to injury, and because of the tight spaces they work in. It is a tough job, and so we set those work simulation up to get them back to work and get those muscles that have atrophied during the injury fixed and back to work.
Okay. So physical therapy is a huge part of the plan. On day one, this orientation. what happens on day one? And then we're out of time. So what's going on day one? What can they expect?
Well, on day one,
the paperwork's all been done. They're approved day one.
Well, by that point, that 2 or 3 week period, you already have a relationship with my staff. Okay. 1 or 2 or 3 of the women you will already know over the phone. And you show up. We always have breakfast there. We have a first day orientation. You meet the other patients in the program. You spend your first hour usually with the psychologist, and then because you have one-on-one time with the psychologist every day, you also have group time. And then we acclimate you to the gym, and then we do lunch, and then we go back after lunch. And so you're gradually put in the program at your comfort level.
We're out of time, and I want to thank you for coming on the show. But final message, somebody, injured worker, what's your final message to them?
Randy, I think my final message to the injured worker is that if you have not called the Chronic Pain Institute in Houston, Texas at 281-481-4357, you have not done all you can do to manage your own pain.
Okay, and for those people that have never even heard of this 20-day program, you got to find out more.
Give us a call.
Okay, good. I want to thank you for coming on the show. Very interesting. Good. You've been watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. If you would like to see this interview again or point a friend or a loved one in the direction of this interview, you can go to our website at wellnesshour.com and just put in pain management or pain. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.